Welcome to Powell Pediatric Care. This is our Get Acquainted meeting for expectant parents, and in the next 20 minutes or so, we want to give you the information that you need to make an informed decision about your pediatric team. We'll start with everybody introducing themselves. My name is Chris Houts, and we'll start down here with Michael.
Morning, I'm Michael Franks.
I'm Laura Osthaus.
Hi, I'm Sarah Kelly.
And let's see, a couple other introductions. Dr. Wade Wild is in the back of our office, seeing walk-in patients this morning. Dr. Dr. Adebomi Omakunli will be here soon. And then later this month, we are being joined by a new physician from Nationwide Children's Hospital. She just completed her residency and will be joining us, Dr. Jackie Pennywitt. So there are 7 pediatric clinicians here. We will start by talking a little bit about how it works in the hospital. If you're delivering at Riverside Methodist Hospital or Dublin Methodist Hospital, we round on newborns there. We also round at Nationwide Children's Hospital. But for the hospital routine, we'll ask Laura to start us off, share information that these guys want to know.
So there are some of you who are delivering at OSU or another hospital that we don't round at. If that is the case, you'll be seen by the hospital pediatrician. They will examine the baby. They will fax us all the information about the baby. They will tell you when to make the first appointment in our office. If your baby's a boy and you're choosing a circumcision, that pediatrician will do the circumcision in the hospital before you leave. Any discharge information that you're given, please bring with you in case the fax doesn't reach us. But we will, and they'll tell you when to make the appointment, and we'll get to that, the timing of that in a minute. We'll talk about that. So if you're delivering at Riverside or at Dublin, you will be seen by one of us, and throughout your hospital stay, one of us will see you each day. You don't need to pre-register with us because we can't register baby in the computer till we have a firm date of birth. So all you do is when you go into the hospital, they will ask you who your pediatrician is going to be. And you circle any one of our names, and then the hospital notifies us after baby is born. So you don't have to do anything other than that. So hospital notifies us. We come out and examine the baby in the nursery. We're always going to come out within 24 hours of the birth. Usually that will be early in the morning because our routine is usually to do our hospital rounds early and then come to the office for the day. So usually we're out early in the morning, but always within 24 hours. So we take baby into the nursery, we do a thorough exam, then we come out and we discuss the exam with you and any findings, any questions you might have. Often there aren't questions the first day. If baby's born at 3 a.m. and we're out there at 6 a.m., you don't have any questions yet. You're still exhausted and glowing. So we come out every day, which is a distinction of our practice. So we do come out and see the baby every day. And so if you have a C-section and you're there for 4 days, we'll be out every one of those days, asking, seeing how things are going, examining baby again, and answering any questions. If your child is a boy and you're choosing to have a circumcision, that will generally be done on the first morning. We talk to you about that beforehand, and we have you sign a circumcision consent beforehand so that we can answer questions. We also have a really good handout from the American Academy of Pediatrics on circumcision. So if you have lots of questions or you're still deciding, you can get that. I think it's right there on the shelf. You can get that and help make your decision. The most frequently asked question, though, is about pain control. We don't want baby to feel the procedure. We make baby very comfortable. A little trace of sugar water and a pacifier to suck on helps with pain control. We use a teeny bit of sugar water because we don't want to interfere with breastfeeding, but it helps baby feel comfortable. And then most importantly, we do an injection of lidocaine. So we numb the area. Baby does not feel the procedure. Most babies sleep through it and then wake up at the end when we're using a wet wipe to wipe them off. So it really is very comfortable. I see some people looking skeptical, but it really does happen that way. We don't want baby to feel pain. So we see baby every day. On the last day, the doctor who discharges you will let you know when to make the first appointment in the office, because we are going to customize that based on how baby is doing. So if there's yellow jaundice, if there's a lot of weight loss, we'll see baby like 1 or 2 days after discharge. If everything's going well and baby's already starting to gain weight, we may see you several days after discharge, but we're going to base that on how baby is doing and specialize it for every individual family. Most babies are losing weight at discharge, and that is normal. It takes 2 weeks to get breastfeeding well established. So we're going to work very hard with lactation, with the hospital to get breastfeeding off to a good start. Babies do lose weight. A lot of that is through the meconium that they lose. And milk doesn't come in until day 4 or 5. So a lot of babies are in a weight loss pattern initially. So most breastfeeding babies will be seen within a few days of discharge. We look at the medical evidence when we're doing, all our decisions for babies, and breastfeeding is the most healthy form of food for baby, and there's health benefits for mom. So we work really hard to get that off to a good start. If there are medical reasons why you can't breastfeed, the hospital is going to start you on Similac Advance. That's a great formula to start with, and we can talk about formulas when you come into the office, but that's a good one to start with. We also start the Hepatitis B vaccine series in the hospital. That is done within the first few hours of birth. They will have you sign a consent form at the hospital. We do like you to have that vaccine at the hospital. It makes our vaccine series space out really nicely for that one.
So a big part of what makes your experience different in our office is the team that backs us up. So we oftentimes at these meetings talk about there being great pediatricians in Columbus, Ohio. A lot of them are our friends and acquaintances. But what can make a difference for a family when you're considering a practice is who backs them up. Who's the team that backs them up, both administratively, for billing, and especially for nursing. So we want to introduce you to some of our team members, and we'll start off with Deb, who is our office manager and has been a part of Powell Pediatric Care for a number of years. She's going to talk to you about how it works for scheduling in the office, pre-scheduled appointments particularly, and also billing questions, that sort of thing. So,
in the packets that you were given, there's a blue sheet of paper, and that is the schedule for your baby's well care appointments. It starts at 1 month, 2, 4, and keeps on going. When you're in the office for your very first visit, stop at the checkout counter and get the 1 month and 2 month well care appointments scheduled. The reason for that is we limit the number of well cares we do, especially during the winter months, so that we've got enough same-day ill appointments. So our well cares do tend to book out about 6 weeks. So go ahead, stop, get the 1, 2 month scheduled, and then when you're here for the 1 month, schedule the 4 month, and just keep on top of them. As far as sick visits, if you call first thing in the morning, you are almost always sure to get in for a same-day sick appointment. We very seldom run out of appointments. If you're calling late in the afternoon and we don't have any appointments available, the front office will put your call back to the triage nurse. She will get more details from you, run it past one of the physicians to see if you might need to go to one of the urgent care facilities or if it might be something that can wait until the next day. We do have walk-in appointments Monday through Friday from 8 a.m. to 9 a.m. for very simple illnesses, rashes, pink eye, sore throat, and ear pain. We are also here most Saturdays, unless it's a holiday weekend, for ill appointments from 9 to 12. Any questions about scheduling appointments? Nope. As far as urgent cares, Nationwide Children's Hospital has close to home centers, one in Dublin, one in Westerville, right on Cleveland Avenue. And COPC also has a pediatric support center right on Cleveland Avenue. They are open during the week from 5 to 10, and then on Saturday from noon to 6. Insurance. The most important thing to remember about insurance, you've got 30 days to get your baby added to an insurance policy. Don't miss that 30 days because then you're on your own until open enrollment. Call up your insurance company at about, as soon as the baby's born, it's a good idea to go ahead and call the insurance company or call your HR and get the paperwork rolling. But at about 3 weeks of age, call your insurance company and make sure that they have everything that they need. It's always a good idea to confirm they've got the gender correct because a lot of times they get it wrong, date of birth, and that they've got the name spelt correctly. If you're with United Healthcare will start to show that the baby's eligible under mom, but at that 30-day mark, they're going to kick the baby off, and he's going to start showing ineligible. So it's important to follow up with United Healthcare. As far as Medicaid or state insurance, we are only with a network with CareSource. So if you are on Medicaid, make sure you tell your rep that we are only in network with CareSource and to put you on that HMO program. We are within network with all major insurance companies, so that's not a problem. If you're unsure whether we're in network or not, you can call into the office and check with us. If you start getting bills from COPC that look like your insurance has not processed any of the claims, it might be because the claims got dropped before the baby was showing eligible. So all you need to do is call the COPC accounting department and ask them to reprocess those claims.
Basically, to kind of reiterate what I said earlier, key to your experience is our team. And we are so fortunate to have all pediatric nurses in our back office. That is definitely a distinction of our practice. We're very, very grateful for it. And to give you a little bit of an idea of how things work there, Beth and Lindsay are going to talk about nursing phone advice, which is a big part of all pediatric offices. They're also going to talk a little bit about immunizations. And you guys can throw in anything else you'd like to. You just have to hold this microphone. All right.
Well, I'm Lindsay Lee, and this is Beth Blankenship. We're both the team leaders at the nurse team leaders, I should say, at the practice here. And we, one of our main jobs is working nurse triage, and so we we're one of the, or two of the nurses that we'll speak with when you call and ask questions. It can be as basic as asking for Tylenol dosing. It can be as complex as my child is having some trouble breathing. Should I have them seen now? Can I have them wait? Type of things. We ask when you call in, a lot of times you'll be leaving a voicemail. We ask that you leave the child's first and last name, date of birth, it would be helpful as well, and then your name and contact number with a brief message on what your question is, just so we can kind of triage it a little bit before we call you back and get some information. If it's a breathing concern or something more urgent, we ask that you actually call the front desk and ask for one of us, just so that we can get on the phone with you quicker. Sometimes we can't get our messages off quick enough in order to triage and call you back quick enough. So we'd like for you to definitely call the front desk and hit option 0 and ask for a nurse if it's something more urgent. Another thing that we do in the office is immunizations. We obviously are very, all of us are feel very strongly about importance of immunizations, and we all follow the AAP guidelines on that. So if nurses can't answer questions, we kind of pose it over to these guys if you have specific questions on immunizations, but we definitely feel strongly about sticking to a schedule and the importance of the immunizations that we give.
You will always get a phone call back within that business day. So the nurses will always call you back. They will also have whatever advice they give you reviewed by one of the physicians. So whatever advice they give, they'll have it sent to one of us doctors. We'll review it. We'll see if there are any changes or additions and call you back. But you'll always get a call that day. And the triage part of it is just putting things in order of priority, so that if your baby's having a breathing issue or a high fever, you'll get called back before a question that's about, routine feeding or something like that. So they just put it in order of priority. So sometimes you get called back very, very quickly. And then sometimes if it's winter, it may take an hour or two, but you always do get called back.
Dr. Bomey, welcome. Sit on over here by Dr. Kelly. Sorry. Yes. Fresh back from vacation is Dr. Bomey. And I see a question. Yeah.
So our nurses are great about answering those phone calls and triaging things during the day. However, if it's after hours and you have an urgent question that cannot wait until the next office day, you can always get a hold of one of the physicians 24/7, 365 days a year, including holidays. So you just call our main number, follow the phone prompts, same thing, leave a message with a good contact number where we can reach you, and we'll get back to you to answer your question. So you're either going to get one of us, or if it's during the hours that our pediatric support center is open, which is, again, 5 to 10 on weekdays and 12 to 6 on weekends, you'll get the nurse and the physician there calling you back. And then we'll give you advice and figure out, what can be done overnight until the next business day. If we decide that your kid needs to be seen that night and it can't wait until the next business day, then we're going to direct you to go to one of the pediatric facilities. So either the Pediatric Support Center, which is over in Westerville, which the nice thing about that is that's just going to be the same as your office copay. It's not going to be an urgent care or ER copay. It's an office copay. So that's a really nice option for you if it's after hours. Or the other option would be Nationwide Children's Urgent Cares, which again are in Dublin or Westerville. There's also a Nationwide Children's facility on 23 in Lewis Center, but I'll point out that that is an emergency room. So if you need an emergency room, that's great. But if you don't necessarily need an emergency room, you are going to have that ER copay. So just kind of a caution there. And we strongly encourage using one of those pediatric facilities after hours and not one of the other adult urgent cares or retail clinics, because the adult urgent cares, retail clinics just aren't used to treating children, and we don't want your child to get a wrong diagnosis or wrong medication. So we really strongly encourage using one of those pediatric facilities. And Dr. Bomey will talk a little bit more about the children's ER and hospital.
As far as ER is concerned, as Dr. Kelly mentioned, the ER in Lewis Center is a pediatric ER. There's also one downtown, and that's Nationwide Children's ER as well. We do strongly recommend that if your child does need emergency care, to take your child to either of these two facilities. Because if you do an adult facility, like she mentioned, a Riverside or an Ohio State, for one, they probably would transfer you because they're not used to having kids in their ERs, and so then you're having two copays, an ambulance ride, and the bills start to pile up. And so we always recommend going there directly. Two, if your child needs to be admitted to the hospital, there's only one hospital in town that admits pediatric patients, and that's Nationwide Children's Hospital. So if you're going to Ohio State, you're still getting shipped down again to Nationwide Children's. So the nice thing about Nationwide Children's also is that we all do have admitting privileges at Children's Hospitals. So if your child were to be admitted for something simple like a pneumonia or asthma or maybe dehydration, we would be the doctors taking care of your child. Now, hopefully this doesn't apply, but if your child had a special condition, say like a heart condition or like a kidney condition, something that required a specialist, and the specialist would take care of your child. But we would also still, because we have privileges, be able to come by and stop in and see how things are going, staying involved in your child's care the entire time that you're there. I think we probably are the only practice now that does have admitting privileges at Children's. That's definitely a distinguishing criteria for our practice. Most of the other practices have like the hospital doctors taking care of the kids. So we are probably the last game in town that does that. So again, something great for your child because you have a familiar face. You can ask questions if you feel like, with a team rush through and we still have questions, you can always ask us, and if we don't know, we'll be glad to be kind of the intermediary between you and the specialist team as well.
Well, it's really important to us. What we strive for is high quality and personal care. We don't believe in fast food drive-through medicine, so we intentionally limit the number of patients we see an hour, and that's so that we can take time for your child. So we really encourage people, take about an hour, expect an hour to invest in the office for a WellCare visit, especially for new patients, for first-time families. It's going to take about an hour to get a diet history, to talk about sleep, to do a developmental assessment, to see your child, to give immunizations, and just answer all your questions. So we're really about investing time in you. That's why we invest in hospital rounds, both at the nursery and Nationwide Children's Hospital. So if that's what you're looking for in a practice, I think we'd be a good option for you.